Hello everyone, my name is Walter Alvarez and I have the pleasure to present to you my preliminary research proposal, at least as it stands today. So, who are the uninsured in Canada? I will present to you this short video that will explain it better.
Every Canadian family has an immigrant story, one filled with unthinkable challenges and a will to succeed. Every story starts with a loved one coming to Canada with only $5 in their pocket. It's a story virtually all of them work from the moment they arrive, off the grid, without protection, and often doing dangerous, unpleasant jobs to keep their family moving forward. Perhaps you know one of them, Ronaldo, who presses your pants to help you look good, or maybe Anna, the cleaner at your mom's nursing home. And what about Hassan? He helps build the hospital that we use, but he can't when he slips and falls.
For now, I have it narrowed down to 3 questions. Number 1, what challenges do uninsured people in Ontario face? Number 2, what are the potential implications of this denial of healthcare? Number 3, is denying immigrant patients healthcare in instances of terminal or infectious diseases a violation of their human rights? Now, the best way, in my opinion, to answer those questions is via the following methodologies. Case study. The advantages of a case study, the way I view it and understand it, is that it would delimit the study of my research, for example, to one uninsured clinic here in Toronto, Ontario, instead of trying to understand all the problem about all the undocumented workers in all the countries in the world or all the provinces. We would concentrate on a specific bound case of a specific clinic, at least as part of my research. But I would also leverage ethnography in its representation of autoethnography. And what I mean by that is that I believe that my personal experience, the narrative of my personal experience, would help provide a comprehensive description of what it is like for an undocumented worker in Canada to work hard for Canada and get denied health care. And I believe my experience working with people in that situation could advance academic knowledge. It could advance the cause of the undocumented, and it could advance the cause of humanity. And phenomenology. I'm strongly considering phenomenology because what I want to get at is the essence of what it's like to be uninsured, what it's like to not have insurance. And I also want to get at the essence of what it's like to have to volunteer your time, and I'm referring to the Canadian doctors and nurses, these wonderful professionals who volunteer their time after they've done a shift in their regular job to help the uninsured. And I want to know what the essence of that sacrifice is. And I believe phenomenology would help me depict that essence and understand better the basic structures of that experience. Now that I mentioned the methodologies, essentially, I'm not prepared to dismiss any of the methods because there is a lot of intersectionality of methods with the qualitative methodologies. So I believe interviewing is one way that will help me get an understanding one-on-one about that experience and the essence of what it's like to be uninsured, to not have health insurance, and also at the essence of volunteering for helping these people. And observation, it's another method that I would utilize simply because it would allow me to understand this will be accomplished by immersing myself and participating on these uninsured clinics. One clinic for the people without health insurance in Toronto specifically. And focus groups would help me because I would like to meet and have interviews, group interviews with the professionals, some of the professionals that volunteer their time to help uninsured people. This includes doctors, nurses, dentists, and I would like to get a sense of the way they view the problem and what they perceive as being potential solutions to the problems. And lastly, I would not rule out to review extant literature and records that would provide me information and research that's already been conducted. So that's in terms of methods. And lastly, I want to leave you with the purpose of my research, what I intend to accomplish with this. And the answer is, first of all, I want to, through my dissertation, confirm the existence. So I would like to, once I establish if the problem exists, I would love to establish the scope of the problem, the scope of the suffering and the dehumanization that denying someone healthcare. I want to know if it affects Canadian citizens as well, because many of these undocumented workers have children that are Canadian born, and they could be falling through the cracks and not getting proper health care because of the stigma of having of the parents being undocumented. And number three, I want to tell their stories. These are some of the most wonderful people that I met in my life. They're undocumented workers, and they so optimistic, so hardworking, and they have such love for this great nation. And when they need us, we're not there for them, and their stories deserve to be heard. And lastly, and I believe most importantly, the purpose of me pursuing a doctorate is because I want to leverage all the intelligence, all the opportunities, all my hard work to humanize this beautiful human being. It's time to stop treating them like they're others who don't belong. That's the essence of why I'm doing this. So I hope you like this video. Let me know if you have any questions, and I will be happy to respond. Thank you very much.